Okay. I started recording. It's on? Yes, it is on.
Again.
So, hi everyone, please mute yourself. Is there any age range for women having spasmodic pelvic floor muscle? Like they can happen normally into early age between 15 to 15 to 25 when they have this fear of having sex is going on sometimes, or normally after having a child as a mother there might be spasm. You can understand after having the vaginal delivery it might be some kind of traumatic experience for some females, and which can lead them this kind of issues, and even that damage to the muscles when they have too much of scar and adhesions happen into the pelvic floor. They can also show secondary vaginismus to the females, so the mothers can also have it, and early reproductive life. Please mute yourself. Please mute yourself. Be careful that you're not unmuted. All right. So this is the second. This was the third muscle. Patient can also show you that she's having pain during defecation. So we can understand that some kind of pain can be there because of this tension into the bulbocavernosus, the upper fibers. So we'll think about that. And then pain during the arousal when female is getting sexually aroused. That time also she might experience some pain if she has tension into the bulbocavernosus, because during arousal time body is getting relaxed and ready for the penetration. Vagina is getting what we are saying is a not a lengthening, it's stretching. The stretching of the rug is going on during that when we are ready for that. We want the lengthened vagina during sexual activities. So body is getting ready for that, this effect. So this particular time, we want relaxed pelvic floor. We want relaxed bulbocavernosus. So the penetration should be smooth and easy inside the vagina. So this particular time, if female is having pain during arousal time period, so might be during arousal when the muscles are getting relaxed and stretched out, the tensed fiber or tight fibers of the bulbo, they are get pulled and they are showing the female pain during arousal stage, external pain around the clitoral structure, around the sexual organ externally. So we can feel that this tension of the bulbo can show pain during this particular time also. The next is now this muscle is on the top of bulb of vestibule also. So whenever we are sexually active and the muscle is when the muscle is relaxing, so relaxing is moving. So when it is moving away from each other, it is not only moving like when the female is aroused for sexual intercourse. So this muscle is not only relaxing like this, so the vagina can get more protruded and more ready for the sexual penetration. So this is now relaxing like this, but this relaxation, these fibers of bulbo is moving outward and downward, outward and downward. So once this fiber will move downward, so what is present beneath the bulbo? So this gland is present beneath. So when this muscle will move downwards, assume that these two muscles are moving downward. They will put pressure over the bulbs or the glands which is present down. So there are two glands are present. One is this bulb of vestibule, and just underneath here there are another two small glands are also present. In this you will be able to see this small gland. This is a Bartholin gland and this is a bulb of vestibular gland. So these two glands will get pushed because of this downward contraction of the bulbocavernosus, or this downward movement of bulbocavernosus. And when it will compress the bulb or this gland, the liquid which was present into these two glands, they will come outside. Now the female will start having more lubrication or more wetness during sexual arousal stage. So now we have a skinous gland. So through the skinous gland, the liquid from this will come outside, and we have two glands from the Bartholin gland, 4 and 8 o'clock of the vagina. So liquid will also start coming outside from this compression of these glands. So if the female is having a good functional bulbocavernosis, which can create a movement, action. It will also do compression effect over the bulb, and the bulb, so means lubrication will be always good and better in this case. If the female has a dryness going on into this part, so we can understand that something is happening. Either the glands are not producing enough liquid, so means lack of estrogen can be the issue. So we have to ask our female if the estrogen deficiency is going on, menopausal time is going on, she's lactating female, she's a mother. At that time, we can understand the estrogen level deficiency can be there. In case of PCOD, we can all understand these things that she might have a dryness because of the hormonal issue. The glands are not functional because estrogen is not there because of the estrogen deficiency. But if the glands are not functional, if there's no issue at all, she's not lactating, all these kind of hormonal issues are not there, still then she's having dryness. There might be that the opening of the glands, openings, the skinous gland and the Bartholin glands, these openings are obstructed, the pipes are obstructed, the passages are obstructed. They can get obstructed by the small dust particle into our panty, some kind of external pathogen. They can start getting, accumulating into the passages, and they might obstruction. Please mute yourself. Zainab, mute yourself. Okay, thank you. So they might create obstruction. So now what is the solution if these passages are obstructed? Simple solution is giving your patient vaginal steaming. So like we can take steaming for our face and they can open the pores, same way steaming around this region. So take a steamer, apply around the area and let the steam fumes go. It will help in opening up this unnecessarily unblocked areas. Okay, so it's very, very important just to go into that side. Third, it might be the pelvic floors are not able to create a compression, they are weak. So if they will not do compression, so for that we have to do assessment. How strong is the pelvic floor? So there can be three things. Because of that, she might don't have lubrication or less lubrication. Estrogen problem, obstruction of, if estrogen problem will be there, glands will not be functional. Second, obstruction into the passage. It can be some pathogens are accumulated, some dust particles are there. So steaming can help in this case. Third, it can be pelvic floor. They are not active. They are not applying the pressure. Or the blood supply. Sometimes the blood circulation is not good because every structure requires blood circulation, isn't it? So that's another important thing. Hi, Dr. Saratu. It's only 77 participants. Can you please give a
yes, ma'am.
Put a message into the group? Why other participants are not there?
Okay, I will.
Please do. So this is very, very important. So this muscle will contract and it will put pressure over the sponge and sponge will get pressed and liquid will come outside. So this is also very, very important function. So I have one question someone is asking. Let me just answer that. All right, Mariam. Have you started? Okay. Are there clinical provocative tests for vaginismus? How do we confirm the diagnosis, especially when the spasmodic? Yes, dear, I'll give you. Is there any age? I told you already age for this. Can vaginal dryness be correlated with the menstrual cycle? Definitely. During the periods, our estrogen level is down. Okay, that's why we have a dryness during that time. Yes, there's a correlation. Okay, so you understood about bulbocavernosis, and if the bulbo is weak, it will not get pressure and patient can have a less lubrication. If bulbo is tight, patient can have a difficulty into relaxation, difficulty into penetration. Okay, so this is the bulbocavernosis. Now let's move to the fourth muscle. So first was the external sphincter, second is the superficial transverse perineum. External sphincter is a closing opening effect, that is the function. Superficial transverse perineum is a muscle which provides stability to the penile body and the ischial tuberosity and the whole pelvis, you can understand. And this superficial transverse perineum is related directly with the low back. Now you can understand if this muscle will be tensed, how the back pain issue will come because of the SI joint dysfunction. Okay, so this is the correlation directly with the back pain and whole pelvic stability. Third is the bulbocavernosus. You can understand this is again a muscle of opening and closing. Sphincteric effect is there, compressive effect is there, and opening effect is there. So this muscle is attached with the clitoris. So means now whenever we need like this muscle is contracting, this muscle is gonna create contractive effect over the clitoris. So more contraction of this muscle is gonna compress more nerves which supplies the, which is all surrounding in, which is all ending into the clitoris. Now altogether more than 12 million nerves are ending into the clitoris. So many nerves are there. Every nerve of our body is going to end into clitoris. This is the end point. Okay. So that much sensitive this area is. So if all the nerves are ending here and if this muscle will contract, so they are going to create a compression over the nerves. So that is going to give more stimulations during sexual orgasm. Orgasmic effect. When female is going to hit orgasm, there are 5 stages of sexual functioning of a female. First is desire, I want to have sex. Second is arousal. After desire, hormones will be released, signal will be sent to the body will start reacting, and the stage will come aroused. Body will go for arousal stage. Third stage will be penetrative stage or stimulation stage. When the sensations are so high that we want direct touch to the sexual organ, it can be the clitoris during masturbation or it can be the sexual penetration into the vagina. We need some touch, and that touch is going to give us a sensation. Fourth is an orgasm. So orgasm is when there will be too much of contractions going on, too much of myotonia will be there around every area. All the pelvic floor muscles will be tense and tight, and even whole body muscles will be tense and tight. And they are going to create too much of compression over the nerves, which is all present around the sexual organ, the legs of the clitoris, the bulb of the clitoris, and these glands of the clitoris, body of every small muscle which is attached here, they will get contraction and they are going to stimulate the nerves, and nerves are going to send a signal to the brain, and then the brain is going to give this releasing effect. And this releasing effect, they will release the muscles automatically, the tension from the organ automatically. This is what we are saying is an orgasm. So during orgasm, pelvic floor create too much of contractions, and it creates a squeezing effect over the legs and over our whole complete organ. The clitoris will get squeezing effect, and that squeezing is responsible for more sensation. And brain cannot tolerate more than that. That's why brain is sending signal just to relax everything. And this is what we are saying is an orgasm, orgasmic effect. And after that, as soon as we have an orgasm, now squeezing happen everywhere into this clitoris. Now this was the glands. So these glands will also get squeezed. Now they were squeezed, and as soon as the muscle will relax and the female will hit the orgasm, the liquid which was present and which was squeezed here will come outside. And this liquid will come outside from that small skinny gland. It will also come out from the Bartholin gland. And this small amount of liquid, like 5 ml, 5 ml only, not more than that. So this liquid, we are calling it as a squirting. And as soon as this squirting happens, female feel lot of lubrication at that time, wetness around this area, around the vaginal area, and some squeezing also happen into around the vagina. So the tissue, the wetness will also come out from the vagina as well externally. So female feel more wetness. So this is the orgasmic effect. And as soon as this complete squeezing and relaxing, the relaxation will happen of the muscle. This fifth stage, we are calling it as a relaxation stage. Female will feel complete relaxed pelvic relaxed in a whole body. The organ, this organ which was squeezed under myotonia fact will relax, the muscles will be relaxed, the body will relax, the whole body will relax, the mind will relax, and this is the best relaxation stage anyone can feel in our life. No one, nothing is better than this feeling. So this is a completely relaxation phase of the female. In this relaxation phase is going to stay there for minimum 2 to 5 minutes. So female will feel that she don't want to move for 2 to 5 minutes because she felt that much of high sense of relaxation, brain, body, and everything. And now she achieved the relaxation. So in every field you can understand that some there were some stages where muscles, pelvic floor muscles were contracting. There were some stages where the pelvic floor muscles were relaxing, specifically bulbocavernosus. It was relaxing, it was contracting during it was relaxing during that arousal stage, and it was contracting during the orgasmic stage. So bulbocavernosus is the main muscle of sexual functioning. So it is a sphincteric and opening effect is definitely there around the vagina and the urethra, and compressive effect is there around that bulbovestibule, but it has a sexual role because the muscles are directly attached with the sexual organ. So when the muscle will contract, it will definitely going to put compressive effect over the clitoris, and it is going to add up into sexual stimulations. Okay, so it is a muscle of sexual stimulation. Okay, now let's go to the next muscle. And so you can also understand here if the female is having less sexual sensation. So pelvic floor, I'm not saying only bulbo, but the whole pelvic floor plays an important role. And we have to activate the bulbocavernosus muscle in this case. And that strength matters. Either this is a tiny muscle, but it matters. After this, we have a fourth muscle, and this is this muscle which is present on the top of this legs of clitoris. And this muscle is, now this is what part? This is a pubic, and this is a ischium. We are going towards ischium, and this is ischial tuberosity. So we can say pubic ischial rami, isn't it? Pubic ischial rami. So from this ischial rami, one muscle just adjacent to that, this particular part, one muscle is traveling, originating. So origin of the muscle is from ischial tuberosity, from this pubic rami. They will all, the fibers will keep originating, and they will keep traveling towards upside, and they are going to insert into body of clitoris. Now, this is whole part from where the muscle is coming. Okay, before going to this muscle, let me make you feel your bulbocavernosus. Any of them are male, Dr. Saratu?
Yes, ma.
Okay, if you are a male participant, you please touch your penis, the base of the penis. Okay, if this is the whole penile structure, this is the whole penis, the complete, and we have glands on the top, the base over here. Or what you can do, you lift up your scrotum up. So you have a scrotum, testes is there. So you lift the testes and scrotum upside. And after that, you just touch the very bottom root of your penis. Please do that for me right now if you are at a right comfortable area. So you touch that part, and if you are a female, please concentrate, close your eyes, and you concentrate that you have a vaginal opening. So there are three openings. One is for urethra, like you hold your urine. That is a one sensation when your urethra is compressing. Hold your gas, your anus is compressing. Now there's another area, your vaginal area. And vagina is like, assume that your vagina is having a curtain, okay? Some doors is there around the vagina. So these two things you have to feel. If you are a male, you just touch the scrotum, just beneath the scrotum and root of the penis, try to feel it. And if you are a female, assume that vaginal opening in your mind. Now follow my command. Close your eyes, guys. Close your eyes and close your vagina, close your vagina, close your vagina, close your vagina, close your vagina. Relax. If you're a male, squeeze your penis. Feel squeezing in your penis. Squeeze, hold your urine. Hold your urine. If you're a male, hold your urine. Relax. Again, do the same. Close your vagina, hold your urine. Close your vagina, hold your urine. Relax. Close your vagina, hold your urine. Relax. Okay. Did you feel something, some movement there? Rashida, mute yourself. Can you feel some contractions there?
Yes, there is contraction. Something sucking in.
Yeah, something sucking in. This is bulbo. Something is closing, not sucking in. Something is closing. Sucking is a levator ani. Upward sucking is a levator ani. Okay, this closing in. The vagina is something. The wall is coming closer.
Okay.
Feel this? Sucking also will be there because levator is also active. But closing, can you feel that closing? And if you are at a comfortable area where you can touch yourself, you place your both finger around your pubic, over your labia minora over here, and then squeeze your pelvic floor. You will feel the contraction over your labia minora. Close it, open. Close it, open. Close it, open. Around your vagina. Can you feel this closing, opening, closing, opening? And if you are a male, can
Yes,
you?
yes, now it's much.
Yeah, it is mine. So now what do we want to focus on? This is very important. If your patient is urinal issue, you have to always keep giving command about that focus. Hold your urine. So urethra is more focused and muscles around urethras are more focused. If your patient is into defecation problem, like that bowel problem, so focusing on the anus. And if your patient is around this sexual issues, the focusing on to vaginal area or focusing around the base of the penis. So these particular commands are very important. Specific command. Give specific command to your patient. Clear? Okay, so you felt, I think all of you have felt this contraction of bulb. Now, when we are saying, now let's move. Now you felt the contraction of this also, and this also. Uh, so these three things you have to observe when your patient will come in front of you, when she will open up her clothes. So during observation, we have to ask them to close and squeeze the anus, and we have to observe the movement here. We will tell them to squeeze that again pelvic floor, and then we'll see the movement around this tuberosity. Then we'll tell them to squeeze again the pelvic floor and like hold the urine and close the vagina, and we have to visually see the movement action, the closing of the vagina. It means it is action of the bulbo. And we'll ask our patient to squeeze, hold the urine, then we can feel that action, complete action of bulbo around the urethra also. So mean this is important during that external observation and palpation, both. Okay, it's an important part of the assessment. Now I think you are clear. The fourth part is ischiocavernosus muscle. They are coming from the ischium and they are going towards the cavernosa. Cavernosa means that empty chambers. So name of this muscle is ischiocavernosus. Yes, somebody is asking something? Okay. So name of this ischiocavernosus muscle. Please mute yourself, everyone. Okay. Now, you can see that ischiocavernosus. So this is present on the top of the legs. So what is the function of this muscle? Only sexual functioning. Now you can understand that we have a legs present. Now not only the legs of clitoris, they are covering. There are many arteries which is supplying this clitoris. Whole clitoris structure. So we have blood vessels which is going. We have veins which is going. So now whenever this muscle will contract, So this is going to create a pumping. So they are going to put compression over the arteries. So when they will put the pressure over the arteries at a faster rate, it's like a pumping action, like our calf is doing pumping action. So blood will move upward towards the clitoris. So these muscles are they have only sexual role. They have a circulation role, actually, sexual and circulation. They try to provide more blood circulation towards the sexual organ when the female is aroused or when the male is aroused, both, because muscle is present in male and female both. So when they are aroused, and we need that our chambers, we need erection in our sexual organs. So how erection will happen? We need a blood for erection. Now this was a simple empty room. They have a chambers. Now the blood will start getting into this room. So this room will start getting expanding. So these all cavernosas or empty chambers, which is present inside the clitoris structure or which is present inside the penile structure, they will start getting lot of blood. And when the blood is coming here, we make sure, body will make sure the blood will only come here into the room. They should not, it should not go back. We don't want backflow of blood, only coming inside. Now we also know that into this room there are two things. Arteries are also there and veins are also there. What arteries will do? They will bring the blood, but what veins will do? They will drain the blood back. So now what is going on here? This muscle will create lot of pumping action over this arteries. So more blood will start moving towards that at a faster rate. So fast twitch muscle fibers are present into this muscle. So faster rate, they will contract. More blood will start coming up, better filling will go into the room, more filling will start happening into the room. When the cavernosas will start getting expand because the blood is there, this expansion is gonna put pressure over the veins. So veins will be compressed by this expansion, by this erection, which is going on into the clitoris or the penis. And because of this erection, the veins will get compressed, and when they will compress, now they can't move the blood back towards heart. So we need really this kind of fast action. So fast twitch muscle fibers is the muscle fibers which is present into the ischiocavernosus muscle. Good ischiocavernosus, good pelvic floor means better filling of blood inside. It's not only the pelvic floor muscle which is responsible for that. It also depending upon how good is the heart of the person. If there is some heart disease out there, diabetic, if the patient don't have a better arterial supply, the arteries are not in a good condition. Like if diabetes is there, if they're taking a lot of insulin, so they are automatically gonna create a lot of issue with the arterial health. So if the arterial health is not good, they can't drag good amount of blood towards the sexual organs. And if the patient is having high blood pressure also, you can understand that can again affect unnecessary conditions. So it can affect the patient, this feeling of blood circulation. So there are certain other conditions are also there, but this particular part is also responsible. So whenever we are talking about that erection problem, or if you are talking about a male erectile dysfunction, so erectile dysfunction or female, is it? Are you able to hear me now? Can you hear me now?
Loud and clear. You are very audible.
Okay. Sorry. What we were discussing about, I think you have missed this part. Let me just quickly recap. Ischiocavernosus muscle. Ischiocavernosus muscles are present on the top of the legs of clitoris. You can see here, the legs of the clitoris are passing. So this is the legs of clitoris. So on the top of legs of clitoris, this is my ischiocavernosus muscle. So they are originating from this particular ischium rami, and they are inserted into the body of the clitoris like this towards the cavernosas. So whenever this muscle will create action, now what is the action of this muscle? So this muscle is active only during the sexual phase, during the sexual functioning. So whenever male or female, they are sexually aroused. So this muscle is present at the base of the clitoris here, legs of the clitoris. In male, they are going towards that base of the penis. So base of the penis, from there, the blood will start going towards the body of the penis. And over here also, you can see blood will start going towards the body of the this whole legs also, and then body. And legs are getting what we are saying, erection. Erection is happening into the legs or the body, not into this particular part. It's only legs, I think, over here. This particular downward part, legs and roots are going to get erected in a female body, not the body and glands. And in male, they have the complete whole root as well as the body, not their glands, body. And so we have a cavernosas present into the legs or the body of the penis. So now once the male or female, they are sexually aroused. So blood will start, desire is there, blood will send some signals, and hormones will be released. It will give signal to the oxytocin, that will give a signal to the heart, and arteries will start getting relaxed and more towards that area. So all this particular area, we have a chambers. So all these chambers, which is an empty spaces, they will relax like this because of the nitrous oxide released by the brain. So this nitrous oxide release will gonna relax these chambers. When this chamber will open up, now they will start getting filled up with the blood. So blood is coming out from the heart. Heart circulation will be very, very high and fast. You can see the breathing, the heart rate of a female when or male when they are sexually aroused. So more heart will start coming and pumping around this particular sexual organ. In this particular phase, ischiocavernosus muscle will create a contraction. So this contraction will begin during the aroused stage. And during this contraction, this blood, now we have the structure, like we have a blood vessels present, veins are present, nerves are present. So now what this nerves will send signal to the brain, more sensation and stimulation will begin. The arteries, they will bring more blood, so blood will start going towards the complete all chambers, here, everywhere the chamber will start getting filled up and erection will happen. More blood is coming up. Same thing will happen into the penis. And once this more faster rate will be happen by this ischiocavernosus muscle. They are fast twitch muscle fibers is present into the ischiocavernosus. They will do this contraction, and because of this contraction, more faster, at the faster rate, the blood will pump up towards the chambers. So more filling will be happen at a faster rate. And this filling, when it will create a or erection, and because of this erection which is going on at the faster rate, the veins which is also present, the veins will get compressed, because already before the chambers were empty, so the veins was there to drain the blood back. But once the whole chambers are filled up, so they will put a pressure. If I am filled up, so I'm going to expand, I'm going to push everything into this room. So this, because of this push, the veins will get pushed and they cannot take blood back towards heart. So this is what we are saying is blood will stay there, and it will not, they will prevent the venous return, this blood supply. So who is helping? This faster rate is helping. And who is helping? These chambers are helping. So we need nitrous oxide release. So we need a better hormones. We need a better heart condition. So more blood can also come. We need a good chambers to open up. And arterial supply into the whole clitoris and the penis. So more blood can come here, and we need a good pumping action of the ischiocavernosus, so the action can happen at a faster rate. So the compression can also happen at the faster rate. And the fourth thing is bulbocavernosus. Once this whole thing will be filled up, bulbo will contract. And when the bulbo will contract, it will put more contraction over these chambers and for creating the more stimulations. So female can have a good sensation, sexual sensation, male or female both. So this bulbo will also come, levator ani will also start contracting. So all pelvic floor, superficial as well as the levator ani will also create a contractions. Even uterus will contract. Complete internal reproductive organ will start creating contraction. Uterus will contract downward. Bladder will contract posterior. Even rectum will create a contraction. The whole vagina will under the effect of contraction. Whole squeezing effect, vagina will also contract over the clitoris. So the whole clitoris will under the this phase of contractions. And these contractions and compressions will compress the nerves, and that is going to send a signal to the brain, and then the orgasmic reflex is going to begin. So we need this muscle. It's a very, if the muscles are functional, the better functioning, better pump up of the blood will be there. So now what is the role of ischiocavernosus? Circulation during sexual activities. So this is the only role of this muscle and very important role of this muscle. So when we are saying, and after that, bulbocavernosus also comes into picture. It will create a kind of looping, a kind of ring. It will work like a ring. Specifically, it will get a contraction, squeezing effect. So we need bulbo and ischio, both. They both have sexual muscles of our body. So both health is important. So in case of erectile dysfunction, when male is not able to sustain and maintain erection, so we should also count that these muscles can be weak. If the muscles are weak, they will not be able to do pump up. And if the muscles are weak, so arousal will not be there. The erection will not be there. If erection will not be there, so that the stimulation will not get active. So female don't feel aroused. So that can be an issue. So it can be because of low blood supply, less activation of these muscles, or if male is not having erection, so it can be also because of this heart condition, it can be because of the hormones, it also can be because of the weaker arterial health, or it also can be because of the veins. If the veins, in the vein we have a valve, if the valves are damaged because of some reasons, because of this aging effect, the walls get damaged. This is how they can happen. It can happen in our legs also. DVT formation can happen there. So same way, if the walls of the veins get damaged, so the compression will not happen into this case. And if the if the pelvic floor muscles are not strong at all, and bulbo, which is going to create a squeezing like a ring at the base of the penis, because bulbo is attached at the base of the penis in a male, and after erection it will create a clamping effect. So whatever erection is there, blood will not drain back, and the compression will be maintained over the veins, because male erection is visible erection, and we need that for the penetration and all this, finishing this whole act of the sexual act. So we need this kind of ring. You can see that this is my finger, and this is the ring. So same way on the penis, the bulbo is like a ring, and this ring is going to compress, and this ring will contract, more the blood will stay in upper part, and for longer time period, erection will be maintained and sustained. Erection is there because of circulation and because of contraction of this ischiocavernosus muscle. But erection will be maintained for longer time period because of this compression by the bulbocavernosus. If the bulbocavernosus muscle is weak, male might achieve erection, but it will not be able to sustain the erection for longer time period. So that can be one factor. There are multiple factors, as I told you. It can be veins, it can be nerves, it can be it can be veins, it can be arterial health, it can be blood supply, it can be hormones, or very important, pelvic floor. So if the pelvic floor is the reason, so we are there to strengthen the pelvic floor. So this, you can understand how important the role of these muscles are. So what is the function of this muscle? Circulatory function. And what type of fibers are present? Fast twitch muscle fiber. Why we need a fast twitch action? For the blood flow towards the clitoris. So this is the superficial layer of pelvic floor. I hope you guys understood that completely. Is it?
Yes, ma, very clear.
Very clear. Okay, lovely. So would you like to continue with the session, or you want to stop here?
Yes, ma, depends on you. If
I'm
you
okay.
can,
All are there.
then we can complete. Yes,
So
we can have like 30 minutes
yeah, so we can
to
come.
7 o'clock.
We can just go. Yeah, everyone, fine. So let's go to
let's have some
maybe
break
let's just
now.
have a brief recap.
Break.
Yeah, you want to have a break? Okay, let's have a break.
Recap, like.
Yeah, we can have a break if you want, and then we'll just give you a quick recap what we have
Can
done.
I ask a question?
Yes, that's better.
I'll take you
Can
through.
I ask a question?
Yeah, please ask, dear. Please ask.
Okay, I have a question. Like, how would one be able to determine if the sexual dysfunction, so to speak, is as a result of pelvic floor muscle weakness, or as a result of hormones, or as a result of poor blood circulation? What is like the differential diagnosis? How would one be very exact? What would one do? What test would one do to know precisely why, precisely if it is a result of weak pelvic floor muscles? I'd like to know, ma.
Okay. Look, now we are a pelvic rehab therapist. So whenever patient will come to us, we are going to take a detailed history from the patient. If patient is telling us that he's a diabetic, that he's taking insulin, so that is automatically going to give us a signal that their arterial health and their blood supply, their heart health is not good, isn't it? And their veins will be also get somewhere not healthy veins will not be there. So we understood about from this history, we have to take a history, what conditions he's suffering from. So there are certain conditions listed up. If your patient is falling into that, okay, and which medication they are having. If your patient is suffering from, for example, some kidney problems and they are taking some kind of diuretics. So what diuretics is going to do is going to relax the structures. So diuretic, so they are taking diuretics. So medications are going on, and medications can always have an effect. Now, what we can do when the patient will come to us, we will simply assess the pelvic floor through our scales. So we'll insert our finger inside the rectum if he's a male, and we'll insert our finger inside the vagina if she's a female, and we'll ask them, the patient, to contract and how much strength they are showing, how strong is the pelvic floor and how strong contraction is there, we are able to feel, and how strong endurance, we have to check endurance also. Endurance they are able to sustain. So there's a one test for that, perfect scale testing. So if the perfect scale testing is 100 out of 100 or 90 out of 90, out of 100, and patient don't have urine incontinence, patient don't have any like fecal incontinence, so other bowel and bladder related health is absolutely fine, he don't have any prostate related issue, and then we inserted finger, we found the strength is also 5 out of 5, 5 plus out of 5 plus as per Oxford grading scale. So and the address is also fine, means pelvic floor is fine. If the pelvic floor is fine, so this person is no, then we will go for a functional testing. Functional testing. There's another test. So what we will do, we add some weight actually around the penile area, penis. So we hang a weight. You can take a weight like a 100-gram weight or 50-gram weight. You can put the weight into some condom or some. You can put that weight into glove, and after keeping that weight, so you will have a hanging weight, and then you can tie that at the base of the penis, and after tying it you can ask a patient, then your patient, like, you know, it's like again your patient has to have the erection. If erection is not happening at this particular time, so why erection is, so erection is there or it is not there. If erection is not at all there, so for erection we know, we understood that we need a very sensitive environment. There are some hormones to play, some kind of phases, stages to go through. Now erection is not something they can just do in front of us. They require some kind of stimulations for that. Now, if the then we'll ask them, the erection is going on sometimes or erection is not sustained. Erection is never happening. If erection is never happening and we found that our pelvic floor is strong, but still erection is not happening, it means the patient is not related to the pelvic floor, because pelvic floor, other criteria, bowel, bladder health is good, no issue with it. It's only erection is the issue. So it might be that arteries are the issue or blood supply is the issue. Okay, so you just check your pelvic floor. If that strength is 100 out of 100, then it means the pelvic floor is not the culprit. There might be other findings. Okay? Clear?
Okay. Yeah. So thank you.
We will check our pelvic floor because we are pelvic rehab therapists. Okay. And yeah, go through the history. Yeah, okay, dear. So let me have a break of 10 minutes, and after 10-minute break, we'll go for a quick recap, whatever we have done through our PPT. I am so sorry so far, you just heard me. There was not even a single slide I have shown to you. But let me go through that quickly. Okay.
Okay. Thank you.
See ya. Hi everyone, I'm back. Are you there?
Yes, Ma, we are here.
Right. So please keep, can you please put a message in the group that the meeting is starting?
Okay.
Thank
We
you.
are around.
So how the session is
We are
going?
here.
Very educative as always, ma'am.
Thank you.
Very informative.
Thank you, Dr. Rita. Thank you.
Okay.
Okay, so let me share that screen with all of you. People are joining, and Dr. Saratu, please let them in.
Okay, ma'am.
Okay, so can you see the screen is visible?
It's blank.
Yeah, I'm saying.
Okay, yeah.
Yes, visible.
Visible?
It's visible. You can see
Is it
it's visible.
Okay,
Yes.
great. So just keep moving it, and then you can just go through it. There are some participants are still on WebEx. Can you join me on Zoom? There are still some participants on WebEx. Can you please join me on Zoom? So yes, yeah, share the screen. Which screen is visible? Can you see that slides, or you are able to see me only?
No, the slide is visible also.
Okay. Can't see the slide. All the participants from WebEx, please move to Zoom. Stop share. Share. Dr. Azim from WebEx, please move to Zoom if possible. Okay, now it is visible, isn't it?
Yes.
Yeah. Okay, so this is what we were discussing about, and we have learned so far through our online webinar also, the recorded session which I have shared. And again, let me give you a quick recap, which we have done so far is this. Pelvic floor muscle. Pelvic floor is like a diaphragm which separates pelvic cavity above to the penile area below. We understood that. And this is the female pelvis. This is a female pelvic bone. So 4 important structures are very important to understand. The difference between that male and female pelvis is simultaneously equally important. Like male is having a broader, narrower pubic symphysis and elongated sacrum, and ilium crust is quite higher. Ilium is quite higher in male as compared to female. Female is having a shorter pubic symphysis, shorter sacrum, which makes the whole pubic bone shorter into diameter and length. So, but it is oval into shape, more diameter, more width is there in a female sacrum. And pubic arch is always different in male and female, approximately 60 to 70 degree pubic arch into male and 80 to 90 degree pubic arch into female. So we already aware about that, and these are very important when you are going to palpate your patient. Please look for the pubic arch angle. And ligaments are there. There are 4 important ligaments which is holding this whole pelvis in a right position. Anterior, like you can say that we have a ilioinguinal ligament, we have a sacroiliac ligament, posterior sacral ligament, pubic ligament. The ligaments are very important to make a right positioning and tilting in the body. So we don't want any ligament tense and tight. You can understand if ilioinguinal ligament, which is into green color, which is present between the ASIS and pubic symphysis, if that ligament will become tight and shortened, how it is going to create more anterior tilting of the this pelvis. So it's very important that we need a good, movable ligament. We don't want any tension into the ligament. Okay, so tilting is always related with the ligament. If they are loose and lax, the patient can have a tilting. We understood the pelvic organ in a female body and a male body. So in female body, we have 3 organs present with 3 canals. In male body, we have 2 organs present with 2 canals. And in female body, you can say, just you can understand that behind the pubic symphysis, our first organ is present, that is the bladder. And bladder is a hollow muscular organ, which is made up with the smooth muscle, and it is having its canal. This is a urethral canal, and urethral canal is having a 2 opening. One is towards the bladder, and one is going towards the external vestibule. We can see external opening of the urethra. So there are 2 openings of this, external urethral opening and internal urethral opening, and this is the bladder. Bladder is lying into the pelvic cavity, you can understand here, but when it is empty, but once it starts getting filled up with the urine, it is going to expand up and it can move towards the abdominal cavity also. It is very, very kind of movable organ, which has a good stretchability. So very effective for the storing of the urine. And this muscle, the bladder is having again some anatomy of the bladder is there, which is already shared with you on online sessions, but we will discuss again. After that, we have another organ present in a female body. This is the uterus. Uterus is present on the top of the bladder. Uterus is not behind the bladder. Very important thing. It is on the top of the bladder. Again, uterus is having its cervix. The downward part of the uterus is the neck of the uterus. We call it as a cervix. And cervix is protruded into the vagina. And the cervix is having 2 parts. One is this external os and one is this internal opening. There are 2 openings of the cervix. Internal opening is open into the uterus and external opening is open into the vagina. So once you insert your finger inside the vagina, you can definitely palpate the cervix of a female, and internal or external os you can palpate. Cervix is having its, uterus is having its again a passage, that is a vagina. So this is a vaginal canal which is quite longer into size. And when we talk about the urethra of a female, it is 4 centimeter long. But when we're talking about the vagina, it can vary. The size can vary from 6 centimeter to 9 centimeter, and it is highly expandable into nature. So that expansion happens depending upon what you want to do. It is like a condom actually. If you want to insert a finger, it will take the area of your finger. And if you insert a big penis inside the vagina, it will expand up to the penis. If the baby is coming outside, it will expand up to the head of the baby. So the highly expansion is there because of the circular ring which is present inside the vagina, and that is the rugae. And same way you can say that behind, so this vagina is present behind the uterus. So behind the bladder. So this is a bladder and bladder posterior wall where my cursor is going. So behind the bladder posterior wall, upper part of the vagina and lower part of the cervix is present. And behind the urethral wall, vaginal lower part is present. So this is how the presence of the vagina behind the bladder and the urethra, posterior part of the bladder and urethra. Same way you can understand we have a last organ. This is a rectum, which is the last part of the colon, and it is quite large. It has 3 zones, upper zone, which is very close to the end part of the colon, and then we have a middle part where we can palpate the uterus and the vagina, and we have a lower zone where we have a more anal this puborectalis muscle is present across this, and high anal pressure is maintained here. So this is more outward part. So these are the three structures, organs present, and we have this very small canal of which is attached with the rectum, and this is the anal canal. It is 3 centimeter into 3.5 centimeter long, 3 to 3.5 centimeter. It can vary person to person, but normally 3 to 3.5 centimeter long. This is the shortest canal into the body out of these three canals, and but very, very strong. The sphincters around the anus are very strong, both internal as well as external sphincters. Then you can understand at the very posterior to the sacrum, we are having this rectum, we have a sacrum, and we can also palpate the coccyx. So transrectal approach, and we can definitely touch the coccyx of a person by inserting a finger inside the anus, both in male and female. If we talk about the male body, so you can understand the central organ is not present. So what is present here? We have a pubic symphysis, we can palpate that. Behind the pubic symphysis, we have a bladder, and bladder is quite bigger into size because they have more space there. So the expansion is also higher than the female, and size is also bigger than the female. And this is also, we have a long urethra present in a female, and this urethra is passing through the prostate. So we have again a gland which is present, which is important part of the reproduction, and this is the prostate. So urethra is passing through the prostate like this, and then we have two passage into the urethra. You can say one passage is coming from the bladder, and one passage is coming from this gland, which is attached with the seminal vesicles. So there are three passages which is all present here. Two are coming from either side of the seminal vesicle, and one is coming from the bladder. And they are merging into the urethra, and this is the long urethra, approximately 17 to 18 centimeter. So quite longer than female, and we have more angulations also present in a male body. And you can say that it is coming out through this penile structure, which is a sexual, which is working as a both, which is serving as a both urination as well as for the sexual behavior. Whole penile structure is made up for the sexual functioning, but the urethra is there for urination and ejaculation. The penile structure is there for erection as well as ejaculation, but urethra is there for urination also. So there are three functioning which is coming from this particular area, that is the ejaculation, erection, and urination. And then we have a scrotum present externally. This is the external genital of male, penile as well as scrotum. Scrotum is having two testes. Testes are like we have two ovaries in our body, which is male reproductive organ. Same way, male reproductive organs are testes. And they are securely, very securely secured into the scrotum. And scrotum is always maintaining the temperature of the testes so they can keep producing good amount of semen. And then we have posterior to this bladder, we have again just posterior to the bladder, we have a seminal vesicles present here. And then posterior to that, we have a rectum present. So posterior structures are same in male or female both. But once you will insert your finger inside the male body, you can palpate prostate. And when you will insert inside the female anus, depending, again, let me explain you by erasing it. So when you will go for transrectal approach in female body, so as soon as you will insert your finger, you can palpate what? You can palpate vaginal posterior wall, and you can palpate uterus, and you can sacrum, you can palpate posteriorly, you can palpate the coccyx. But once you will insert your finger inside the male rectum, anterior organs are going to change because they don't have a vagina. So directly you can palpate the first organ, that is a prostate, and then you can also palpate posterior wall of the uterus. They both are palpable through transrectal approach in male, and the posterior structures are same like in female, sacrum as well as the coccyx. So these are the structures which is present in a female organ, female body, pelvic cavity. And when we talk about the pelvic floor muscle, we all know that pelvic floor muscle is present at the base, at the floor of the pelvis. And they are attached with the four corners. The first corner, you can say that any corner can be first. You can see the pubic symphysis, then ischial tuberosity, then we have anal we have this coccyx, and then we have other side of ischial tuberosity. If you join all these four corners together, you can see that a diamond shape. So this is why we are saying the pelvic floor muscles are diamond. And if you will create a straight line, if you join both ischial tuberosity from one side to another side, like this, you can divide this diamond into two parts. One will be upper part, which is gonna be work as a urination part and a sexual part. So we call it as a urogenital part. And downward is the rectum as well as the anal part. So anorectal part. So this how this triangle, this diamond can be divided into two triangle, urogenital triangle and anorectal triangle. Then if the female is in front of you, because our session is more emphasis are going on female pelvic floor rehabilitation. So in this, you can say that whenever female is lying in front of us, we can see the mons pubis of a female, which is all presence of the hair is there. On the sides, labia majora is present. Then we are having both side labia majora. Then we have this labia minora is coming, which is going upside. And there are two joining of the labia minora. The downward joining is this one. So this part we are calling it as a vaginal fossa. And then we have upward joining when it is creating an external, again, a further extension. And this extension is creating glands, not a glands, it's a, what is this? It's our clitoral hood of the clitoris. Okay, and into this is skin expansion of the this glands, this skin of the labia minora, and this is the clitoral hood, and inside the clitoral hood we have our sexual organ glands is present, the glands of the clitoris. Once you will open that, this is particular part, these two flaps, when you open it, so you can see this is a part, we are terming it as a vestibule, and into vestibule we have a urethra present, and then we have a vaginal opening is present downwards. And after this perineal body, when the this minora started going up, please mute yourself. When vagina started going up, labia minora, so downward this skin which is present between that above than this anus, this particular skin is a skin where the perineal body is lying. So this they are calling it as a perineal body. And then we have an anal canal, anus which is present here, and then we have anococcygeal body and coccyx at the back. And both sides of the sides we are having ischial tuberosity. If you remove the skin, the structures will be something like that, and you will be able to see the organs. Like assume that you are removing the skin, so you can underneath the skin. This is the bulb of vestibule, which is a big gland which is attached with the legs, root of the legs of clitoris, and both side. And you can say urethra is also crossing, and vagina is also encircled by these two muscles and these glands. And we have these glands of clitoris, and this is the body of the clitoris, which is attached with the pubic symphysis, the connective tissue of the pubic symphysis. And this is there with the one ligament, and we call it as a suspensory ligament. So you can understand the female whose space between these two tubercle will be higher, so this suspensory ligament will be weaker. So it means the attachment which is holding that sexual organ with the pubic symphysis, that attachment will become loose and weak. So, or if we have a tension into the pubic symphysis, the pain is there, so that can give referred pain to the suspensory ligament, and that can give a referred pain to the clitoral structure also. And female can feel this kind of pain during the sexual arousal stage, when clitoris will start getting erected. So that erection will pull the organs, and it will automatically create a pain to the patient. So if pubic symphysis pain is there, so we should never forget that why the pain is there. So you might have to release the pubic, this particular area. You might feel some kind of trigger points. So that's why palpation of the pubic symphysis during our examination is the must. So we will always start from here, palpating the pubic symphysis. You can see that we have small Bartholin gland is also present on the both side, and they are attached with some kind of openings. both sides of the vagina. This opening is present between the outer skin of the labia minora and between the hymen of the vagina. Both of in between that particular space, the openings are present. Sometimes openings are not visible in every female, but sometimes we can see this opening visible, and sometimes you can also see some kind of Bartholin cyst if these glands can become bigger and swollen if there is some kind of obstruction happen into these passages. Okay. And this is the structure, and you can see this is the ischial tuberosity, and this is perineal body, and this is anal canal, this is external anal sphincter, this is anococcygeal body, and this is the coccyx at the back. These are the glutes which is attached, and these are the deeper pelvic floor muscles. Now let me take you to the next slide, and these are the very, very important things which we should be having understanding: mons pubis, pubic hair, labia majora, minora, vulva, clitoris, vestibule, perineal body, anal opening, and anococcygeal body. So you can say all the way from front to back, all these structures are visible. Mons pubis, pubic hair, labia majora, labia minora, so all these structures are visible here. And the diamond shape and the triangles are important to understand. This is something which I have already cleared through my online sessions, which I shared with you. So I'm not going into this. Let me, this is the scaneous gland, both sides of the vestibule area, both sides of the urethra, 4 o'clock and 8 o'clock. These are the glands which is coming from this big, what we are saying, gland of vestibule. And they are providing the lubrication. And these are the opening coming from our Bartholin gland, and they're responsible for providing the lubrication around the vagina whenever female wants to penetrate, she's ready for penetration, either for the finger, gynecological examination, pelvic floor examination, or sexual activity. So always we need a lubrication. So these are the important structures to note down, and we should be understanding a very, very important structure of a female, that is the clitoris. And unfortunately, not most of the person, they are having a lot of myth going on around about clitoris. It is a small structure, P-shaped structure, something like that, but it's quite long structure, it's homologous to penis. Penis is present externally. We can see that erection, but our structure is present inside. We can't see the erection, but organ is present. Even the whole world was not aware about this important organ of a female. We got to know about in late 20s. So you can see that how our medical, we are so much of advancement into medical field, but no one was knowing about the clitoris. The detailed understanding was not there. So it's only 1990, approximately that particular time, the world started getting understanding about more clear understanding about that we have this kind of organ is also present in a body. This is a cadaver picture. You can see in a cadaver how this flaccid vestibule, bulb of vestibule is present. This is a urethra. This is a vagina which is collapsed. This is the legs of the clitoris, and this is what I was saying, the veins. If you understood, like we were just discussing, that these veins are all just present behind this labia, this ischiocavernosus muscle. So more contraction of these muscles, even the arteries are also present, complete nerves are also present, the whole structure is present here. So once these muscles will start creating contraction, they are going to increase the action towards the clitoral structures. So beautiful structure God has given us. Again, you can see this is the side section. This is the deep dorsal veins of the clitoris. This get compressed when our muscles are active during the sexual arousal stage. And this is the green part. The purple part is the body, and this is the glands is going on. This is the root, and this is how this is the cadaver. This is the bladder, and bladder is having this urethra, and we have this uterus, which is a retroverted uterus in this female. It is falling backward instead of falling forward, and this is vaginal canal, and then this is a collapsed rectum of a female, and this is the anal canal, and this is the perineal body, and after that you can say anococcygeal body here, and then all sacrum posteriorly. So you can see the cadaver also, and you can relate that, now you can understand it more clarity. Beautiful image, one of my favorite image, this one. You can see how beautifully our clitoris and the glands of the vestibule is encircling that, this particular urethra. So urethra is passing through that, and as well as the vagina is also passing through that. This image is important to understand because our vagina is not sexually sensitive. This is not a sexual organ. God has given us our own sexual organ, clitoris. Then the question comes, why we feel sexual sensation from the vaginal penetration? Please mute yourself. Please mute yourself. I request whoever is not muting, please check yourself. So why we feel sexual sensation through the vaginal penetration? Because once we do penetration inside the vagina and we are gonna, this is a vagina, if you penetrate like this, you are gonna touch the posterior, this particular part of the clitoris from the vaginal wall. So posterior part of the vagina, posterior part of the clitoris, you will touch from the vagina. So if this is a clock, so you can assume that 12 o'clock will be towards the clitoris. So you can understand that 10 o'clock or 11 o'clock is a part where you can touch this particular clitoral structure inside the vagina. 10 o'clock and 11 o'clock on right side and 1 and 2 o'clock at the left side. So whenever penis is gonna do touch to that 10 and 1, 10 and 11 and 1 and 2, this is gonna give pressure over the posterior part of the clitoris and we are feeling sexual sensation. So this is very, very important and beautiful picture to understand. You can understand that we are inserting our finger. Please mute yourself. Someone is not muted. Can you check? It is disturbing sound. Dr. Fatima Binta. Dr. Fatima. Please careful, dear. We are just going for a quick recap. So then you can insert our finger here and you can understand how 10, like this one, 11 o'clock, 1 and 2 o'clock, and then 10 or 11 o'clock, we can touch the clitoris. And why? This is the reason why we are feeling sexual sensation during penetration. 30% of females are only sexual, they feel the sex or orgasm, during vaginal penetration. Normally 80%, 60 to 70% female, they don't feel good satisfaction and they don't even hit orgasm with the vaginal penetration. Now you can understand why, the reason. Okay, so we know this organ and this is a bladder. So I think you have already gone through the bladder through the videos. Again, this is a quite hollow or muscular organ which has 3 layers: outer peritoneal cavity, middle detrusor layer, and the inner is a interstitial mucosal layer. So these layers are present, and out of these 3 layers are important. They will expand all of 3 and they will contract all of 3, but major role is done by the detrusor muscle, the middle layer, the detrusor muscle of the bladder. And you can say that when the detrusor will contract, the urine will move downwards, sphincters will open up, and voiding process will start. And we want to fill up the urine inside, we need a relaxation of the detrusor, so we can have more filling internally. You can also see we have 3 openings. 2 openings are coming from the ureters. We have 2 kidneys, so 2 openings are present here at the posterior part of the bladder, and then when we have one opening of the urethra. So 3 openings are present. If you join them together, this is a area we call it as a trigone of the bladder, where 3 openings are joining somewhere. They are situated. So this is the trigone of this area, and into this trigone we don't have stretch receptors present, and even the skin of this area is different, and even the mucosal sheath which is present throughout the area, throughout this bladder, we have some kind of sac, umbrella like sacs present, but these sac are not which is going to expand, like these umbrella like structures are going to expand when we are going to have the filling inside. But as soon as now this sac-like structure are not present into this trigone, and into this upper part we have stretch receptors present, but in lower part we don't have stretch receptors. This particular lower part, the trigone, they can always accumulate, they can always have some part of the urine, and approximately 50 ml of urine is always present here. And this 50 ml of urine, because it is not coming in direct connection with the stretch receptors, so this urine is not putting any pressure over the nerves, and nerves will not send any signal to the brain that I have some amount is left here. So that's why this urine which is present into this particular small area, trigone area, we are calling this urine as a residual volume of urine. And the normal residual volume of the urine is 50 ml. If the residual volume of urine is more than 50 ml, it's 80 ml, 100 ml, 200 ml. So it means that more urine is there and diffuser is not able to contract. So diffuser has to contract and propel all the urine outside. It's only that much of urine, 50 ml, can stay, the part which is into trigone. But if the urine is more than that, it's 100 ml, it means diffuser is underactive. Diffuser is not able to create a contraction. So diffuser problem is there. So when residual volume is high, it means bladder problem is there. Okay, and if this urine is less than 50, for example, and it's not filling all the time, it's only 200, 250, that much of amount is only able to fill inside the, normally the bladder can accommodate approximately 400 to 600. But if this much of accumulation is not there and female is only able to accumulate up around 200 and 250 and the sensation is high and she's going for urination again and again and the frequency is very high, and normally 400 to 600 we can accumulate, and 6 times a day, 6 to 8 times a day is the normal frequency of urination. But if frequency of urination is more than 8 times, it's 10 times, 12 times, 15 times, so that is not a good behavior of the bladder. I have already discussed that through the video, so you can again go through the video to understand that. Someone has raised a hand. Yeah, please ask your question. Excellence, you can't hear? Please ask, dear. Someone is asking how many centimeter from external anal sphincter to the coccyx. It will be 1.5 knuckle, 1 to 1.5 knuckle. Normally 2 to 3 centimeter. Okay, someone is having a question, but she will ask us after the session. All right, I respect. So this is, we understood. Please go through the videos. This is simple. A long penile structure, or long urethra of a male, and you can see the urethra which is visible in a female. So this is a female vaginal opening, and this is upside here is a urethral opening. This is a small structure, okay, which is present in a female vestibule. More seen here, you can see this is a urethral opening, this one, small external urethral opening, and this is a vaginal opening like a flower. And again, this is a urethral opening and this is a vaginal opening. And this is a, can you see urethral opening is more bigger? This is prolapse of urethra. Urethra is prolapsing. So you can, so this is normal structure. So if you found something like that in any female vestibule, it means the urethra is protruding downwards. So that ligaments which is supporting the urethra, the muscles which is supporting the urethra, they are weak. Pelvic floor which is supporting the urethra can be weak also. This is the glands of the clitoris, the clitoral hood, and where we have a glands of the clitoris present. Okay, so this is the male urethra, which I already told you. And the micturition process, I think you have gone through that video already. Very important slide. We know that urethra is supported by vagina because urethra is behind the vagina. If vaginal anterior wall will have a good tone, so that is gonna always give support to urethra and urethra will not fall back. If vagina is lax after having childbirth, the vaginal wall will start falling backwards. So it means that the support which it is providing to that particular structure will be weak. So you can understand this is a vagina and this is urethra. So if vagina will have a good tone, anterior wall of the vagina, so the support will be maintained, extra support will be maintained towards the urethra. But once the vagina will be lax and weak, so that can start falling backward. And this is what we are calling it as a prolapse of urethra inside. You can feel that prolapse of urethra by inserting your finger inside the vagina 12 o'clock towards the anterior wall. And you can also feel that prolapse external into the vestibular area, external urethral meatus prolapse. Urethra is falling downwards into vestibule. So yes, that can be there, and So vagina is providing a very good support to the urethra. So urethra is supported by urethral ligaments. It is supported by pelvic floor. It is supported by vagina. So there are three, and it is supported by the facial sheath, which is all there present here. So there are four structures. And very beautiful and important picture. So this is uterus, and this is urethra. This is bladder and urethra. This is uterus. This is you can say cervix, vagina, and these are the pelvic floor. This is the pelvic floor. So how beautifully the vagina, urethra, and anal canal is going to pass to the pelvic floor. So pelvic floor is very important structure, and we need a good pelvic floor to support our bowel, bladder, and sexual health. Normally, the uterus is present into anti-version, anti-flexion position with the help of its ligament. There are four ligaments. Anteriorly, we are having round ligament. Posteriorly, we are having uterosacral ligament, and both sides we are having a broad ligament. So these are the four ligaments which is present. Not four, actually three pair ligament, two round ligament, two uterosacral ligament, and two broad ligament. So these are the three ligaments which is supporting the uterus in a right position, but sometimes some females, they can have a retroversion of the ligament of the uterus. It can start falling backward like this, or this is like a condition which is not going to affect their reproductive health and periods, but definitely it can affect the pain or internal mobility. If this kind of retroverted uterus is there, female can always complain about back pain issue, constipation, pain into the tightness. It can be because of the tightness into uterosacral ligament. So tight piriformis, tight coccygeal muscle, tight pelvic floor muscles, they can be there. So I'll give you more explanation about that when we'll proceed ahead during assessment. And you can say that vagina, the layer of the vagina is very vascularine. Too much of blood supply is there at the posterior part of the uterus as well as the whole vagina. Too much of veins are also attached. So the nerves are only present at the lower part of vagina. Nerves are not present at the upper part of the whole vagina. So if this is a vaginal cavity, so if you can say that this all are the vaginal canal and you are divided into 100%. So out of this 100%, only the last 25% part, lower part, there only we have a nerves. We don't have nerves present in upper part. If you insert your finger inside the vagina, you will touch your vagina, the sensation will not be there. So our vagina is not a sensual, and the sensations are not very high there. The few amount of nerves are there only. But yeah, vascularity is very high, and this vascularity is because the hormones will keep coming and going as per the blood supply. Blood is going to bring the chemicals, the hormones. The good estrogen is responsible for the good tone of the vagina. Whenever estrogen will go down, the tone of the vagina is going to go down also. And we need a good this vein also, you can understand. So good in and going out of the blood from this whole layer. And due to this particularly lot of blood supply, our vaginal internal the sheets of the vagina, like this particular sheet, you can say this internal part. Again, vagina is having a three walls. One is the peritoneal outer wall, when this is a smooth muscle, and this is more internal mucosal layer. Because we have too much of blood supply, so that's why our vagina is too much vascularine, and it is very functional because of the presence of good and healthy bacteria into this particular part. Throughout the vagina, mostly into upper 50% part, we have a lactobacilli bacteria present. And this bacteria will keep doing its production of the lactic acid, and because of the production, the liquid will be, or the droplet of the liquid will keep coming outside, which is responsible for creating that lubrication and wetness inside the vagina. This particular ring-like structures, we are calling it as a rugae, and they are the part which is going to stretch out and in like a rubber band. And our vagina can get any shape and size, whatever you are penetrating, they can get that size. So vagina.
I apologize for the interruption, doctor, but we can't see your screen. Please, can you share your screen?
Dr. Azel, you are on WebEx. Where are you, at WebEx or Zoom?
No, on Zoom.
Not all can see the screen.
We
Can-
can't see the screen, ma.
Yes or no?
No, the screen is not visible.
No.
How come?
Okay, Ma, you stopped to explain something to us, then you forgot to share it again, ma.
No, how come? Just give me a minute. I think, Doctor, is the screen is on the WebEx. Is it, Dr. Eza?
I can see the screen.
Okay, that was on the WebEx. Dr. Eza, you have to join me on to Zoom. Can you see the screen now? Girls?
Yes.
Yes, we can, ma.
Oh, this is vagina. I'm so sorry. So can you see now? Yeah. Mm. You want me to make it? Yeah, it's visible. This is the bone. It's visible now, isn't it?
Yes.
Yes, ma.
So this is what I was showing you. Mons pubis, labia majora, minora, vestibule. You have already gone through that into video. Scaneus gland, clitoris. This is, yeah, I'm sorry. This was very important image. Can you see this cadaver? So this is the cadaver. You can see the clitoris here, and you can also see with the clitoris, this is the legs of the clitoris, and we have veins, we have arteries, we have nerves, which is going on. Whenever this muscle will contract on the top of it, they are going to create an action into all these structures, and they're going to improve the blood supply towards the clitoris. This is a bulb of vestibule, which is how it is.
Oh no.
It is
Dr. Sunita, you don't have to go back so far. We were with you. We were with you to this point. You don't have to go back so far. It was
Okay.
just for some few minutes. Yes.
Okay.
You
Okay.
can go ahead. Yes.
All right, yeah. Please tell me, yeah, if you have. So it was only for a few. Okay. This is what we have clear, yeah, micturition. Urethral support, yes. Over here I stopped, isn't it? Urethral support by vagina and female. Yeah, so this is the uterus, and this is how beautifully uterus is placed on with respect to the bladder. This is a bladder and uterus, vagina. So you can see that this urethra is supported by the vaginal posterior wall, and this is a pelvic floor muscle where my cursor is moving. And this particular pelvic floor muscles, these organs are going through that. So good pelvic floor will not let the organ to fall back, pull downward. If pelvic floor will have a weaker tone, the organs will start coming downward, and pelvic organ prolapse can happen. So pelvic floor muscle is very important, and if the pelvic floor muscles will become relaxed, it will help in voiding and penetration. And if the pelvic floor muscles will be tight, it is going to create an obstruction, and patient might have a painful urination, painful sexual activity, or painful defecation. So we need a good tone into pelvic floor. We don't want hyper or hypotone. You can see here that uterus is present in the anteversion and anteflexion position, and this position should be maintained, and it is maintained by the ligaments. So there are two ligaments, anteriorly down ligament, two posteriorly uterosacral ligament, which is between the uterus and the sacrum, and two broad ligament on the sides. So they are responsible for the positioning. So if anterior ligament will be tight, patient can have a more anteflexion of the uterus. And if more anteversion flexion of the uterus will be there, it will not let the bladder to expand, because the bladder needs expansion whenever filling is going to happen. But if the bladder, this uterus is more flexed anteriorly, hyperflexed anteriorly, it can be because of the shortening of this ligament, round ligament. So it is going to put the pressure over the bladder, and bladder can't expand, and the female cannot accumulate enough amount of urine inside. So her holding capacity of the accumulation capacity will go down. So it might be that she might go if only able to have the urine filling up to 200, 250, 300. If that much of urine is also only getting filled up into the bladder because it is not able to expand, so it means it is directly going to increase the frequency of urination. Normally, female should go for urination 6 to 8 times. Male should go for urination 5 to 7 times, not more than that. If it is more than that, it is a problem. So this can happen because of this anterior round ligament tightness. If the patient is having, and this can be very, very common in case of C-section, after C-section scarring. Whenever we have a C-section, there are incisions happen. Incisions can create a scarring, adhesions. They can create adhesion into these ligaments, and this whole area can become tight, and they can create a tightness into all inguinal cavity. And that's why if your female is there where the history was C-section and her urination frequency is more, so you can understand now what can be the reason here. So you can palpate her suprapubically, apply pressure, deep pressure, and try to locate the painful zone and try to locate the adhesions. If you found there's an adhesion, try to reduce the adhesions with your techniques and your heating modalities, your manual mobilization, your visual mobilization, your massage techniques, and it might relax those adhesions and it will increase the mobility, and automatically the pressure from the uterus, the bladder will be less, and female frequency you can control. So very important is this, and same way we have a uterosacral ligament which is between the uterus and sacrum. So it is not only into the sacrum, only 81 out of 100%, only 11% of female, their uterosacral ligament is coming from the uterus and inserted into sacrum. 83% of female, their uterosacral ligament is inserted into the coccygeal muscle, pelvic floor muscle, last part of pelvic floor muscle. So you can understand if uterosacral ligament is tight, so how it can give tightness to the coccygeal, piriformis, sacrum, back pain, those kind of issues can be there. Coccydynia, they all can happen if the female is having a tight uterosacral ligament. So we should always keep in our mind, we will definitely have more other sessions to understand female internal organs like uterus and all this internal women health. We'll try to have more sessions. And after that, we have a vagina. You can see that this is a part of the uterus which is protruded into the vagina. This is the external os, and this is all vaginal cavity. And into this vaginal cavity, there are three layers of vagina. Again, outer is a peritoneal layer, middle is a smooth muscle, and inner is a mucosal layer. Into mucosal layer, we have a different smooth muscle. Can you see this is smooth muscle, this is the connective tissue, this is squamous cells. And throughout the vagina, we have this squamous cells present. Only at the lower part over here, we have epithelial cells present. And throughout the vagina, we have a squamous cells. And these cells has a special quality. It's a kind of mucosal shell, which keeps secreting some kind of mucus. So, and into this particular whole vaginal upward part, if you try to see it from the back side, so this is a uterus and this is a vagina. And you can see here, this particular whole vagina. If you divide that in 100%, so this is the vaginal upper part and this is the vaginal lower part. So we can see here vaginal opening, external into the vestibule. So now, can you see that only lower one-third part, we have veins present. And we don't have veins, that much of vein is present in, nerves. Not that much of nerves are present in upper part. Upper part is not sensitive. Only lower part is sensitive because of the presence of the nerves. Upper part of the vagina is not that much sensitive. Now, why we are having sexual sensation during intercourse? Because of the indirect touch to the clitoris from this anterior wall of the vagina. Otherwise, vagina, if you insert your finger inside the vagina, you will just touch every side of the vagina. It is not sensitive. If vagina would have been sensitive, now you can understand what will happen when the female is having childbirth. Baby is coming out and all the nerves is going to send signal to the brain, and the brain is going to give you that kind of sensation. But it's not like that. We don't have that nerves which is supplying around the whole length of the vagina. Only lower part of the vagina is having the special nerves. which will send a signal. And in the lower part, there are two things, that nerves are also present and pelvic floor is also present. So pelvic floor will create a squeezing and relaxing. So that is again automatically going to give add on into the sexual stimulation, arousal or orgasm, everything. And now it is very, very important that how healthy our vagina is or our uterus is. There are too much of vascularity, too much of blood vessels, which is supplying the whole vagina. And because of that, vascularity is very high and our vagina is very functional. It means that smooth muscles of the vagina, the connective tissue of the vagina, the squamous cells of the vagina, they all are highly functional because of the high blood supply. And into this upper part of the vagina, because you can say that mucus production is always there, and we have our lactobacilli bacteria, which is lying here into upper two part. And this lactobacilli will keep producing lactic acid, and that's why this is maintaining the pH level. Our vagina is kind of, it's not very, very acidic, it's alkaline into nature, but upper part of the vagina is somewhere acidic where we don't have lactobacilli bacteria. But this lactobacilli bacteria is maintaining the pH level of vagina 3.5 to 4.8. So this is a healthy pH level where healthy bacteria can survive, and unhealthy bacteria, which is too much of which need too much of alkaline into nature, like more than 5, that bacteria cannot survive here. So we need a good pH level, which is acidic also and which is alkaline also. And this pH level is maintained by lactobacilli bacteria. So this is a special quality of our vagina, that we have a good pH level, we have a good, these are the rugged ring-like structures. They can expand like a rubber band, they can contract, the baby can come also outside, the big baby. So please mute yourself. Please mute yourself. Who is not muted? Offer delay, please. Jane, Dr. Jane. Someone else is also there. And please, dear, mute yourself. My request. We're just going to finish. I know you might be getting late for something. And this is the anal canal. I was telling you about that anal canal, and this is the upper zone, middle zone, and the lower zone. Lower zone is, we have this kind of folds are present, rectal folds are also present into that area. Into lower zone, the pelvic floor muscles are present, okay? And now whole canal is present also into the lower zone. Whole anal canal is present. So this much is the anal canal, and you can see that anal canal is all covered by the pelvic floor through length, okay? And over this lower part, we have many, many veins and arteries. Too much of blood supply and too many veins are there. So just to create a compression effect onto these veins, we need high pressure. We need a good pelvic floor muscle contraction. So the pressure can be maintained and veins can start getting compressive force from the downward side and blood can go, venous draining can happen. So this is very, very important. Sometimes if your pelvic floor muscles are weak, you cannot put compression, that can give rise to the hemorrhoids or piles. Yes, this is a beautiful image where you can see, you can even, please take a screenshot of this image. And I have already covered that into our webinars. So this is beautifully ligaments which is supporting the bladder. So this is the ligament, pubourethral ligament, which is supporting the bladder. There are ligaments which is supporting the cervix. This is uterosacral ligament which is supporting that uterus. So there are many supportive structures are there. We have this facial sheath present here. We have pelvic floor muscles present here. And we have this perineal membrane, another ligament which is supporting externally this whole urethra. So urethra, vagina, and uterus, bladder, rectum, anal canal, they have their own ligaments to support. And with that, we have a pelvic floor muscles also, we have facial sheath also, and even organs are supporting each other. Bladder is supported by vagina, uterus is supported by bladder, and rectum is supported by posterior part of the uterus. So same way, they are also supporting each other. So this is a beautiful explanation, and now we know that there are 2 openings in a female body, 3 openings in a female body, 1 for urethra, 1 for vagina, and 1 for anus. But in male body, there will be only 2 openings. Okay, and the our upper part we are calling it as this particular part is urogenital hiatus, where urinal and genital area is crossing. So in urogenital hiatus of a female, there are two openings, but in urogenital hiatus of a male, there is a one opening. And this is a rectal hiatus that is present. One opening is present in both male and female. Anal canal is passing. And this is a beautiful pelvic floor muscle, which is my favorite and which has given me everything. And I'm so proud to become a pelvic rehab therapist. So you can see this is all coming from every side, and there are three layers: superficial, middle, and deeper layer. And now we understood the function also of superficial layer, and tomorrow we are going to understand that. We also understood the external anal sphincter, and tomorrow we are going to understand middle layer. And the function of the pelvic, now this way, the external superficial pelvic floor muscle is supplied by pudendal nerve, which is coming from S2 to S4. And this branch, this pudendal nerve is supplying not only the superficial layer of pelvic floor, it is also supplying the middle layer of pelvic floor. So we'll discuss about middle layer tomorrow, and I hope that today you got some understanding of the pelvic floor. This pudendal nerve, after coming through this greater fossa, it's coming here, greater foramen, it is entering beneath the ischial tuberosity, and it is gonna divide into some branches. One branch will go around the external anal sphincter, one branch will go towards the perineal body, some branch, so these are the middle branches, this is the inferior branch, and then some superior branch is going to go towards the genitals area, labia majora, bulbo cavernosus, bulb of vestibule, our clitoris, glands of the clitoris, body of the clitoris, legs of the clitoris, they all be supplied by the upper part of the upper branch of the pudendal nerve, superior branch of the pudendal nerve. Okay, so this is how the important structures are giving the sensation. Now, when we say that our complete this particular vulvar area, this glands of clitoris, maximum nerve endings are there into the glands of clitoris. You can say that ilioinguinal nerve is also ending here, operator nerve is also ending here, posterior branches of posterior cutaneous nerve is also ending here. So many nerves all together, and this is a beautiful image where you can see every nerve is gonna finish there in our sexual organ. This is making our clitoris or sexual organs more sensitive. It can be the clitoris or it can be the penile body in a male. So glands is very sensitive, which is the last part. Glands of the clitoris or glands of the penis. And whenever we are having a touch, so more sensations, very highly sensitive that particular area is. Tomorrow we'll start from this particular slide, middle layer of the pelvic floor. So I'm stopping here. Yeah, you can see the screen now. Any question? I'm sorry, at last I was going fast because I thought you guys might be getting late. Any question? Thank you so much, everyone. If you like my video, so please subscribe my channel also. You will keep getting more updates and more learning from that. Okay. Any question or done? See you tomorrow.
Thank you so much, Ma.
Thank you, Dr. Saratu. I'm sorry whatever disturbance we had today.
No problem, Ma. No problem.
We'll start from Zoom. I'll do both
Yes.
open Zoom as well as that others.
Okay, no problem, Ma. Thank you.
Thank you, Ma. Thank you very much.
Thank you.
Thank you.
See you tomorrow.
Thank you. See you tomorrow, everyone. See you. Bye. Have a good evening.
Bye.
Bye.
Bye. Have a nice day.
Bye, Ma. Bye, Dr. Sunita.
Bye.
Bye-bye.
Bye. Bye. I'm ending the meeting. Bye, everyone.